Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. Next question, another big question for you. So how does pharmacogenomics help with the decision-making process for a clinician?
Yeah, so typically when a physician or other providers make a decision, once again, they take many different clinical factors into consideration to choose the best medication. So for example, you will likely start with, diagnosis. So let's say you are diagnosed with hypertension. Well, there are many different classes of drugs that you can use for hypertension. So then the doctor will need to decide, okay, which class of drug will likely be most beneficial. Does this patient have kidney disease? Does this patient have heart failure? Does this patient have other comorbidities that may affect the medication? So you will go through these different sort of approaches to really pick out the medication. And sometimes, and also the financial side is definitely a factor that you want to consider. So usually you have sort of these sort of a checklist or decision tree in your head where depending on the patient's clinical presentation, how severe it is, and also how quickly we want to control the condition. These are all sort of factor into the decision-making process. And of course, pharmacogenomics will play a role there now, where depending on patients' genetic variants. So let's say, for example, let's say you have a patient who just had a heart attack and they need a antiplatelet therapy, and you may consider clopidogrel. Well, we'll probably look at your CYP2C19 enzyme and their functional level to see if clopidogrel is actually an appropriate drug or not. So this is additional tool that will help you decide the best medication for the patient.
Great. So when you said a little bit earlier, what really stood out is like, it sounds like this could really help someone with comorbidities. And for some reason, like diabetes came to mind. So someone with diabetes is oftentimes trying to navigate 3 or 4 different things at once. And so pharmacogenomic tool could really help sort out maybe a better course of action for someone like that. Is that how you would describe it? Or how would you characterize some of the comorbidities and helping them with pharmacogenomics?
Yeah, so well, in terms of comorbidities, it is really focused on choosing the medication that will be complementary or it will sort of help both conditions. So, for example, if you have a patient with high blood pressure and diabetes, you will likely choose the medication that have shown benefit in both fronts. So that's sort of what you would consider.